In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
And with me in the studio is Dr. Falk Schwendicke from the Department of Operative and Preventive Dentistry at Berlin's Charité Hospital. Hello and welcome to the show. There are two options for bleaching. One is home bleaching and one is bleaching in the office of the dentist. Which one is more effective?
I wouldn't say that you can clearly say which one is more effective. It probably depends mostly on the preparation of the bleaching agents you use. For example, the over-counter products, they are dosed or concentrated in a very low dose because of legal regulations, for example, in the European Union. So you will never achieve as good, as wide results as you would achieve with professional products, which you can get from the dentist. With regards to dental home bleaching and dental in the office bleaching, I don't think there's a big difference. It's probably more the difference of time you need to achieve the result.
So it's faster at the dentist office, I assume?
Yes, for sure. At home it takes about a week, roughly, during the night. At the dentist it takes 15, 20, 30 minutes.
And what about the risks involved in bleaching? Is home bleaching more risky than at the dental office?
I wouldn't say so. It depends on the studies. They are not really pointing into one direction. In general, I think we can say bleaching is pretty safe. Okay. At the dentist, you're working with much higher concentrations, which is the reason why you're faster. So there is a certain risk of, for example, hypersensitive teeth or also chemical burns of the gums. But usually the dentist protects the gums, for example. And so the risks there are also very limited. At home, because of the lower concentration and with a fitting guard or a fitting splint where you apply the material in, I don't think there are very high risks at home as well.
And can everybody bleach the teeth for itself, or are there any patients you wouldn't recommend doing it?
It probably depends on the one hand what you need, what your problem is. There are certain conditions where bleaching won't be successful. That's why I would always recommend to go to the dentist to check that first. And secondly, there are risks associated with, for example, open carious lesions, fillings which are not intact, or if you already have problems with the gums, and then you shouldn't do bleaching as well.
And if the discolored teeth is more inside the teeth, more underlying the surface, is it more difficult to get them white?
Bleaching itself is not really a procedure for external stain removal or something. So what you said earlier with coffee or tea stains, they can be easily removed by professional tooth cleaning, and it should be done instead of bleaching. Bleaching is more for internal stains, as you mentioned, and it can be highly successful for both the color of the teeth itself, but also for teeth, for example, after root canal treatment, which are also darkened, we can bleach them as well.
But one different option to bleaching is the veneers we saw in the report. Are they really an option for just discolored teeth, or do the teeth need to be irregular if you would use them?
No, they are an option for discolored teeth as well. As I said, there are certain conditions, for example, fluorosis or hypoplasia, so where teeth haven't developed correctly. And then bleaching is not really an option, so veneers are a good alternative. But, as you said, veneers are also an alternative in case you have teeth which are not straightly aligned and you don't want orthodontics, then you can use veneers as well.
But isn't it risky to drill away parts of a normally very healthy tooth just to get the veneer into place?
Yes, it is risky. So that's why I would always balance this risk. For example, the risk of having problems with the pulps or the tooth nerve against the outcome. And if there are alternatives like bleaching or non-invasive measures, I would probably prefer them.
And what about the non-prep veneers? Meaning you can just stick them on the tooth and not drilling away any substances? Yes,
they're glued basically on the tooth, which is a very smart alternative because it's non-invasive. They can be easily replaced, with this, which is a second advantage, but they have a problem. You can't always use them because there are certain indications where it won't work with these veneers.
Are the adult years the right time to move teeth around inside your mouth, or is it better to do this over childhood?
I think it's better to do this for children or adolescents. So, for example, 9 to 12-year-olds, you can use removable braces. Later on, which is very common in many countries in the world, in the US, here in Germany as well, is the fixed braces when you're 14, 15. It's the better time because you can use normal growth processes, but nevertheless, if there's the need in adults, then you can still do it. There are several techniques out there which work, which are also quite risk-controlled. So I would say, yes, it works with adults usually as well.
And teeth wander around inside the mouth, even in grown-ups. Like when you grind your teeth overnight, it can sometimes make teeth quite irregular, can't it?
I would say the grinding as itself is usually not the reason for such tooth movement.
Yeah.
There are, in some patients, there are underlying conditions, for example, periodontal conditions, which, for example, cause loose teeth as well. And then you have movement by grinding. But if you have grinding and you want to prevent that your teeth are moving, you can, for example, use splints or braces or aligners or something like that, which do several things. They protect the teeth from the grinding and they keep your teeth in place, basically, so retain them.
What are the risks involved in wearing braces, like tooth decay? Is it a risk?
It is, especially with fixed braces, so brackets. I wouldn't say it's really that risky in adults, because adults are usually, on the one hand, very capable of oral hygiene, and mostly, especially the adults which come to get their teeth aligned, are also highly motivated. So I would say we usually have these problems rather in adolescents, because they have a lot of other things in their head. And what we often see is when the brackets are removed, they have straight teeth, but they have caries on the outer surfaces, which then is also not a very good thing, because you need to treat them again, usually invasively or using other techniques. So there it is more an issue with caries.
So you need straight and healthy teeth.
That's what we aim for, yes.
Let's talk again a bit about teeth whitening, because we got a lot of viewer questions about white teeth, like Donny Bass from Australia. He uses a home remedy from coconut oil and soda for bleaching. Is this a way to get whiter teeth?
To be fair, I've never heard about the coconut oil, but it might make the flavor nice. I would probably not recommend to make my own toothpaste at home. All these home agents, like also, as you said, lime juices, so they are quite uncontrollable. They are either very erosive, so they erode the enamel away, or very abrasive, so you basically scrub the enamel away. And it's not so much just the enamel I'm worried about, it's also the dentin, so at the cervical areas, near the gums. A lot of patients have gum recessions where the gums are going away, and then you're brushing away parts of the root surfaces, which are much softer, and so you can easily produce defects there. So no, I wouldn't recommend it.
So don't produce your own toothpaste, buy a professional one, like Christopher Ernest from Nigeria. He wants to know, how effective are special whitening toothpastes?
There are not really a lot of studies regarding that issue out there. I would probably say they might be effective in removing outer stains to a certain degree, which you would also be able to do when you go to the dentist. They have the same disadvantage. They are quite abrasive. This is how they work. They abrade the stainings away, so you might again cause harm as well. So I would be careful with them.
Okay, thanks so much for being in the studio. Thank you so much.
Thank you.